Hi, I'm Dr. Scott Sainamore.
And I'm Dr. George Varagu from RBK Pediatrics, primary care when you want it, urgent care when you need it.
And we put together this video for you in anticipation of coming into our office for your 7-year-old's well visit this year. We just wanted to go over what to expect, things we're going to be talking about, and some important stuff that we want to make sure we know about our 7-year-olds here. So it's been a whole year since the last time we saw you. We need to catch up, get any updates that's been going on, anything at school, anything at home, any behavioral issues, how the kiddos are eating, drinking, any updates to their medical care. Has any hospitalizations, surgeries? Have they seen any subspecialists for anything? We want to make sure that we're completely up to date with your kiddos. The growth curves are still by far the most important thing that we look at the visit, making sure the kiddos are growing and gaining weight properly. We'll review the development and do a nice full physical exam. So 7-year-olds getting bigger, getting stronger, running around themselves in school. What kind of advice do you like to give for their physical development?
Well, just like other children, these children are bigger, so they need more physical activity. Keep them running around at least 1 hour a day. The way to do this is by joining some kind of organized sport, soccer, little league, baseball, basketball, lacrosse. Get these children engaged. At home, they can run around in their backyards. They can ride a bicycle, just play with other kids, and so forth.
And 7-year-olds now, they're old enough that they're starting to really understand and really remember things. So when we talk about trying to encourage healthy eating and healthy lifestyle habits with the kids, now is an age where we can actually sit and explain things to them and tell them why we want them to do the things that we want them to do. Eating a nice, well-balanced diet is very important for them. Making sure we're getting some fruits, some vegetables, lean proteins. We don't want to be eating a lot of the fried, fatty stuff like that. We want to try to avoid the sugary drinks, the soda, the juices. There is no nutritional value for that stuff for the kiddos. The milk and the water is by far the best source of hydration and nutrition for these kiddos. So we still want them drinking pretty much that. We want milk with meals, water the rest of the day.
Yes.
Sleep, very, very important now. Well, what's your advice for sleep at this age?
Well, the children should sleep, and the most important thing is they need about 9 to 12 hours a night of sleep and consistency. Like always, a consistent bedtime. They go to sleep around the same time. They wake up around the same time to go to school. And the room should be free from distractions like a TV or video games or the phone. I'm seeing more and more children with phones at this age, and they're just on it. And if they're on it, they can't sleep because they're too busy.
That's right. And remember, if we get the good habits into the kiddos now, we don't have to work on this later on.
Yeah.
Safety, very important here. Remember, these kiddos are far more independent now, and they're doing everything on their own, and you're just kind of watching over them now and teaching them. So reinforcing what we want them to do, wearing those seatbelts every time they get in the car, putting that helmet on when they get on their bike, sitting in that car seat in the car. We want to teach them the safety for everything, the right way to do things. They're capable of learning and doing this stuff on their own now. So show them what you want them to do. It does take repetition at this age, so you're going to have to repeat it again and again and again, but it is hugely beneficial to the kids to have somebody following them after them doing that kind of stuff. They're also old enough now that we can talk about more comprehensive topics like safety and fire safety, emergency preparedness, and how to use products there at home safely, like going into drawers and pulling out sharp objects and stuff like that. It's important to make sure we discuss this stuff with the kids so that they know. This is not stuff we want them figuring out on their own. As far as their social and emotional development, what kind of advice do you like to give?
Well, they're bigger, so social relationships with other children, playing with other children, respecting other children, cooperating with the parents and with other children is important. You should encourage empathy towards other people. Those are important things that the children need to learn to do. And they also need to learn how to manage their emotions and learn how to deal with conflict. Just because they want something and you don't want them to give it to them, you should try to prevent all these temper tantrums. I've seen, many children where the parents just give in to make the child stop. That just fosters for more problems as they get older.
Yeah. Look, people are going to say no to them their entire lives.
Yeah.
Better they learn how to deal with that now than when they're a lot older.
Yeah, and you shouldn't coddle them so much.
Mm-hmm.
Yep.
The dental health is also important. Please continue to make sure your kiddos are brushing their teeth twice a day with a good fluorinated toothpaste. Just keep that good habit going there. Nobody likes getting drilled at the dentist, and now they're old enough to actually start remembering it. So try to prevent that one. So the language and the behavior, they're in school now, but school is good, but not enough. You want to be encouraging this stuff at home as well. You want to give them tons of books. Let them read, read, read. We don't want them watching television and just vegging out on the couch when they could be reading and using those critical thinking skills for themselves.
Right.
Well, what other advice do you like to give for the educational development?
I'm big on resolving problems or problem solving. And the way to do this is through puzzles and board games, and have them do age-appropriate challenges.
Mm-hmm.
It's great to have a child figure things out than figuring it out for the child all the time, because one day they're going to be adults and they're not going to be able to figure it out.
Mm-hmm. Entirely.
They're not going to be able to pivot.
Exactly. And the art aspect of this also is very important. The coloring, the expressive aspect of all of this too, making sure that they're getting their practice, organizing their thoughts and able to articulate them properly is very important at this age as well. And they just need practice with that, encouragement and a lot of positivity. Kids respond best to positivity.
Yep.
Screen time, our favorite topic here. What's your advice on screen time?
Screen time. There's going to be more and more of this as the child gets older and older, because now they're going to be getting computers from schools. They have to do their homework. They have to go onto the school boards to submit their homework. You should limit it to 2 hours a day, but it should be high quality educational content.
Mm-hmm.
Get them to work on interactive and informative screen activities. Don't just let them veg out and just watch YouTube video games. I've seen children, they're watching other children play video games.
Yeah.
I mean, I don't know what's with that, but it seems to be a thing for little children.
Yeah.
But it's a complete waste of time.
Mm-hmm. As if playing video games wasn't a big enough waste of time. They're watching other kids play video games. Yeah.
Yeah.
So vaccines, generally at 7 years old, the kiddos are up to date with their vaccinations now. So generally there is nothing to give them. During the winter seasons, we highly recommend the flu vaccine. That one's optional, but we do highly recommend it. Lab work at this age is only if we're looking for something specific. So generally you're not walking out with scripts to go to a lab and get blood work or anything like that. PPD skin tests for tuberculosis may be required for school, sports, programs, and stuff like that. So we do that on a case-by-case basis.
Yes.
So thank you for spending time with us and watching this video. It's going to be a whole year before we see you guys again, but remember, we are always around. We are pediatric care when you want it, urgent care when you need it. We have doctors on call 24/7. You can call us for anything. We are here literally to help you with whatever you need. We would rather you call us and get the real answers for stuff than be looking online and stuff like that. We look forward to seeing you for your visit. Anything you need, give us a call.
Thank you very much.